There is no known cure for Lewandowsky-Lutzdysplasia.
Unfortunately, we do not know how to cure this degenerative disease. Instead, doctors can only try to treat the lesions and lessen any other symptoms. They can surgically remove the growths, but these surgeries have to be done so regularly. The growths come back quickly, so an individual with the disease may have to have multiple surgeries per year to keep up. Doctors may also prescribe drugs called retinoids, which can lessen cell growth for skin conditions and keep the growths from showing up as quickly. They may also prescribe interferon, which helps the body fight viruses that may be partially responsible for the condition. In the end, however, there is no known cure, and only some patients respond to the treatments doctors do have. In this case, the best hope may be just continuing to search for a more permanent solution.
It starts with a few little warts.
So, how does this disease progress? It begins oddly enough at first, with a series of small warts on the skin. For some people, however, these warts and lesions leave the body unusually open to human papillomavirus HPV, and if one gets an infection of that sort, there is a chance the lesions and warts will become larger and more bark-like. These can become malignant lesions in about 50% of cases, and it is in these cases we see the large growths commonly associated with tree man disease.
Insects, parasites, and bacteria may try to live in the growths.
An often unexpected side effect of this rare condition is the bark-like growths act as hiding places for everyday insects. In one case, a man had roughly 12 pounds of growths on his body when he was finally forced to get medical treatment. The doctor who examined him was shocked and horrified with how bad the condition had become, and said it was one of the worst cases he'd seen. The warts on his feet made walking difficult, but the bigger problem was the denseness of the bark on his limbs. The infections there were unable to be easily reached since they were so deep against the skin. The doctor eventually found insects living in the man's growths.
It may be linked to intrafamilial breeding.
One of the factors that contribute to this disease is undoubtedly a genetic component. Interestingly enough, scientists have found the condition may be linked to offspring of blood marriages. It is a recessive mutation that requires two abnormal genes, one for each parent, and in blood-related marriages, it is far more likely for two parents to both have that particular abnormality. In studies of the various cases of people with the disorder, it has been found that a surprising 10% of patients with tree man disease come from marriages where the parents share a common ancestor. Still, this means 90% of people with this issue do not have any inbreeding within their family. So while this may be a slight factor in some cases, it is definitely not always the cause.
Removing the growths will only cause them to grow back faster.
The natural response to seeing lesions and what look like thorns growing on one's skin might be to simply find a way to remove them. However, that doesn't really help in this case. One known victim of the disease went to local doctors for assistance and had the bark-like growths removed. For a short time, he thought he was all right, but then the growths began to come back. Except this time, they actually grew back even quicker. This means while surgery can keep the growths from getting so bad a person can't function, it is really only a temporary solution. One patient named Abul Bajander had 24 surgeries and thought he was cured. The medical world rejoiced until 2018, when the growths began to return. While doctors and Bajander hold out hope,
growths are made of the same components as our hair and nails.
They may look like bark, but the growths found in people with tree man disease are actually not wooden at all. Instead, they are made of a substance we can already find all over our bodies. When HPV gets into the skin, it causes the body to create an excess of keratin, which is what makes up the growths. That substance is also the same stuff our fingernails and hair are made of. In this case, the substance grows out of control with no signal to stop at a certain length or width. This means the growths themselves are not painful, as there are no nerve endings inside them. However, they may be painful when tangled, pulled, or twisted, just like when someone pulls your hair.
The growths can lead to skin cancer and other dangerous complications.
Although some people can find ways to live with the disease, some cases are not as bad as others. The condition can become dire. The growths can weigh anywhere from 10 to 20 pounds, and while they are not painful, they can make eating, drinking, or doing other necessary tasks impossible. Hygiene also becomes difficult. The inability to fully clean their skin can lead to infections that are nearly impossible to treat since doctors can't get past the growths to the site of infection. The lesions may also become carcinomas, which means they are cancerous and can be lethal. One of the more famous cases resulted in the eventual passing of Dede Koswara in 2016. By the end of his life, he was so weak from the growths taking over his body that he could not feed himself or even speak. He may have had one of the most severe cases ever recorded. If the condition is detected early, treatments may be applied, which allow for a more normal life.
It's a skin-related genetic mutation.
While we may not know all the details of how this disease happens, we do know it has many components. People have a genetic predisposition with the genes EVR2 and EVROM. A mutation in these genes leads to a lowering of the skin's immunity to disease, which is why warts and lesions arise so easily. This lower immune system also allows HPV to penetrate the deep layers of the skin. Other risk factors may include diseases like HIV or idiopathic lymphopenia. There may also be carcinogenic factors from the environment as well. Unfortunately, we still do not understand how all these factors work together or what the functions of the culprit genes are. Some victims don't show signs of genetic mutations. But scientists and researchers do know that it is, thankfully, incredibly rare.
Dede Koswara is one of the most famous tree men.
Dede Koswara is one of the most famous tree men.
The condition usually develops during childhood.
The condition usually develops during childhood.
Hey guys, thank you so much for the support and likes and comments down below, and also thank you so much for watching, and I look forward to see you in the next video. Then take care, bye.